Good morning. It's my pleasure to introduce our first speaker this morning, Rob Anda. Rob has been, as most of you know, the co-principal investigator of the Adverse Childhood Experiences Study, also known as ACE, and has begun work, carried on work over a number of years to really launch a movement that ties together the life course perspective within this context of early adversity. I'm really pleased to invite you to the stage.
So I chose this poem for this slide this morning. A friend of mine at CDC who is Indian, Eastern Indian, suggested this poem to me. This is Hindu scripture. The butterfly counts not months but moments, and has time enough. The child learns so easily because he has a natural gift, but adults, because they are tyrants, ignore natural gifts and say that children must learn through the same process that they learned by. We insist upon forced mental feeding, and our lessons become a form of torture. This is one of man's most cruel and wasteful mistakes. The emancipation of our physical nature is in attaining health, of our social being in attaining goodness, and of ourself in attaining love. The higher nature in man always seeks for something which transcends itself and yet is its deepest truth, which claims all its sacrifice, yet makes this sacrifice its own recompense. This is man's duty and religion, and man's self is the vessel which is to carry this sacrifice to the altar. The man whose acquaintance with the world does not lead him deeper than science leads him will never understand what it is that the man with the spiritual vision finds in these natural phenomena. When a man meets the eternal spirit in all objects, then he is emancipated. For then he discovers the fullest significance of the world into which he is born. Then he finds himself in perfect truth, and his harmony with the all is established. I'm now going to tell you about what we envisioned when we started the Adverse Childhood Experiences Study as a life course model. As you can see, I am not a grad. This is my depiction of the life course model, a gold arrow with text, conception to death. I'm not going to quit my day job and become a graphic artist, but I think you can see that this is time moving forward from conception to death, and also probably now moving in the fields of preconception. What is the biology that occurred pre-conception that affects life course? And we have here adverse childhood experiences, ACE. The acronym is ACE, plural is ACEs. And what I told you about a little bit of my sort of personal story of being involved in medicine is I got trained to drill right in here and work here. Intense training to work in here, to work on people that already have disease, disability, or social problems, or to work on prevention. This for me was the field of prevention, and largely is still the field of prevention in many fields. That is, what are the risk behaviors or risk factors for disease, disability, and social problems that lead to early death? And can we modify them or reduce them to reduce the risk that goes up in the lifespan? So this is management of diabetes, hypertension, smoking, treating mental illness, those types of things. And those are great and worthy things. And I'm glad they're there, but they're expensive, and many of them don't work very well, or they work unpredictably. And so what we set out to do is saying, knowing that this red risk stuff is embedded in society and human populations, and the risk stuff is not random. It's in human populations, risk for these things. People that have one risk tend to have multiple risks in their lives, so it's not random. So we said if we can understand what the generator, there's a generator earlier in life that generates risks and risk clustering in the lives of people. If we can If that's true, and if we can learn something about what that is, then you get a handle on primary prevention, preventing these things from occurring in the first place. So we speculated that ACEs lead to social, emotional, and cognitive impairments, and we saw those as scientific gaps now. I really don't think they're scientific gaps anymore. I think the science is good enough to sort of remove these arrows here. And when we did this, we didn't know about the neurosciences that I just presented to you. That happened simultaneously with us doing this research, starting it in the 90s. But now we know the biology of how this works. So what do we mean by adverse childhood experiences? We chose 10 categories. There's other things that obviously could be there. These are the ones we chose. Childhood abuse, emotional, physical, or sexual. Neglect, emotional or physical. Growing up witnessing domestic violence. Having substance abusing, meaning alcohol or illicit drug use. People in the home doing that. Mentally ill caregivers or mentally ill people living with you in your home. Parental discord as evidenced by separation or divorce of parents when growing up, and crime as evidenced by having someone sent to prison, someone in your household sent to prison in your first 18 years of life. The ACE study examines the health and social effects of these experiences throughout the lifespan, and the study was done in more than 17,000 members of the Kaiser health plan in San Diego County. Just briefly, these people are primarily Caucasian, and most of them, 75%, are white. Most have been to college. Half have graduated. I believe about 75% have been to college, and only 6% don't have a high school diploma. And they have some of the best health care in the world. So when you think about that, I want you to think about the demographics of this population when you see what we saw about adversity and its effect on health in this population. First thing that we saw is that adverse childhood experiences are common. I was not prepared for this. Nobody ever taught me this. I was stunned and saddened, and I wept because I was the first person to do the analyses and look at the printouts. I did not. So why wasn't I taught this? I'm an internist. I've been at the CDC for 12 years. I had no idea. Substance abuse, 27%. Parental discord, 23, 17% with mentally ill household members. 13% witnessed their mother being battered. 6% had someone sent to prison. 11% psychological abuse. 28% physical. 1 in 5 had been sexually abused. And 15% had been emotionally and 10% physically neglected. That is, not getting what you need to stimulate the neural networks. Next, what we saw is that adverse childhood experience. So ACEs are common. Number one, ACEs are common. I'll guarantee you now, we now know that ACEs are common everywhere, in every population, in every audience where I've done ACE surveys, they're common. And I'm not going to do a survey here, we don't have time, but ACEs, if we did an ACE survey in this room, I would give you my house if the ACE scores in this room are not higher than what we found in the Kaiser Health Plan, because everywhere I've gone, they've been higher. I'm going to move ahead here. So let's look at domestic violence and the risk of other ACEs. This is what we saw in the data that we had to learn to deal with. The height of these bars is the percentage of people who were emotionally abused in this set here. So this is the percentage. Here's 20%, 40, 60, 80%. The color code is the frequency with which people witnessed domestic violence, almost 17,000 people. So those that never did, it was about 5%. Here's once or twice seeing that, sometimes, often, or very often witnessing domestic violence. And you see this goes up to almost 80%. This is 8%. This bar is 10 times higher than that bar. So there is a 10-fold increase in the probability of being emotionally abused where there is domestic violence. You see the same pattern for the set of bars representing physical abuse and those representing sexual abuse. This was something that really had not been well explored when we did this. We're looking at this in the mid-1990s. So ACEs tend to come in groups. And the way I want you to try to understand that is if you imagine you were in our study You're one of those 17,000 people, and you witnessed your mother being treated violently, physically abused or battered or whatever you want to call that. If you were one of those people that had witnessed that, your chance of having one additional ACE is 95%. So it's almost universal where you see that you would have experienced one of the other 10 ACEs. And half of the time, 52% of the time, you would have experienced 5 or more of the others. So the domestic violence is one stressor, witnessing that, the arousal, stress response. Half the time you would have 5 more, that gives you 6. And we were sort of unsure how to deal with this, and what we decided to do in our analysis of the information was to create a score. We call it the Adverse Childhood Experiences Score, which I think of as a trauma or stress dose. A higher score means more and more cumulative exposure to stress response during childhood, and each one of those 10 categories counted 1 point. We didn't weight one more than another, they all counted 1 point. So when we added them up, we saw that in the Kaiser Health Plan, only 1 in 3 people have an ACE score of 0. That is, had experienced none of those. In between, the percentages are common. At 4 or more, it was 16%, which to me, when I try to think about the health plan and clients in the health plan, is that one or 2 out of every 10 clients that get services of any kind of Kaiser Health Plan are carrying with them the cumulative biology of an ACE score of 4 or more. They don't know that because they've not been taught to understand their life history and their life story in the ways that we're going to talk about today. And the service providers don't know that because they haven't been trained either. And so they don't understand their clients. Now, I think that is something that can change relatively easily. Relatively easily. So what we did is after we created the ACE score, 0, 1, 2, 3, or 4 or more, we put that score against various health and social problems, the percentage here. So the height of these is the percentage of people in that study who had become regular cigarette smokers, daily smokers by age 12. Regular smokers by age 12. This is those that were current smokers at the time of the survey. Their average age was in the mid-50s. And here is the percentage of people in the survey who had chronic obstructive pulmonary disease, chronic bronchitis or emphysema. So this is the life course, the ACE pyramid. The life course model tells us that more and more ACEs lead to more and more initiation of smoking in young people. That behavior is sustained over the life course generally and leads to the disease, COPD, that occurs when the lungs are ruined and gets diagnosed usually late in life in the 60s, 70s, and 80s. Here we have alcohol. This is the percentage of people who say that they are alcoholics, self-reported alcoholism. This bar is 6 times higher than that bar. So 6-fold increase in the probability of an alcoholic for an ACE score of 4 compared to 0. And it affects relationships, who we relate to, who we connect with. So this is the ACE score and saying that you had ever married an alcoholic, both for men and women combined. So it affects relationships. So ever marrying an alcoholic is more than twice as high here than here. Risk factors for being infected with HIV, the virus that causes AIDS. Here is shooting up drugs with a needle and syringe. This goes up. This bar is almost 0, almost 0. This is more than 4%. So the height of this bar relative to that bar is so high. It's like 40 or 50 times higher. And in studies of health and health risks, you almost never see bars that look like this. Number one, this is a staircase. See the staircase effect? That's called dose response. That's why I call this a stress dose. Cumulative dose of stress. So the more and more poisoning of stress, the more and more response you get. In this case, the responses are things that generally we don't want people to have in their lives. This is sexual activity, having 50 or more lifetime intercourse partners, and here is ever having a sexually transmitted disease. Teen sexual behaviors, if you're interested in teen pregnancy and teen sexual behaviors. First intercourse by age 14, staircase effect. For the women, ever having had at least one teen pregnancy, and for the guys, ever having impregnated a teenage girl. So adversity and stress influence the probability of teen pregnancies occurring and also beginning sexual activity earlier in life. All right. I'm going to do one thing very quickly here. Let's take this injected drug use. Right? Who here is familiar with the idea of trauma-informed care? About 6 or 7. Okay, you are not, at the end of this presentation, you're going to now understand trauma-informed care. I'm going to divide the room diagonally here. See this row here? Okay. One set of people, and that side the other set of people. Okay. Jane, you and your cohort of people are shooting heroin here in the room. Okay? You all right with imagining that? So all you folks are shooting heroin. You are not. You're not shooting heroin. Take a look at them. Come on, are you afraid of heroin users? They're really, come on. Look at them. You afraid of heroin users? Why? If you are, why are you? Are they bad, stupid people? With the wrong color skin from the wrong side of the tracks? Who didn't get the health education pamphlet that says, you know, if you shoot heroin, it probably is not a good thing and it might hurt you? Why are they doing that? They have high ACE scores. They're much higher than your ACE scores if you have ACEs at all. As a group, their ACE scores are really high. What high adversity does to sequential neurodevelopment is it tweaks up the emotional, the midbrain, the emotional systems, and how the emotional systems interact with the thinking systems, and how the emotional systems interact with the immediate arousal response systems down lower. So they're in a different state. It's not a wrong state, it's not a right state, it's not a stupid state. It's the way it's an adaptive state. The brain adapts to the input that it has, which makes them adaptive people just like you. Their adaptation to their experience is what it is. So they shoot heroin because life is confusing and painful, and things have not worked right. They probably didn't do well in school. They have difficulty functioning. Life is painful, and they're in environments where this is available, and they use it, and they shoot up and say, this is the first time I've had drug use, it's the first time I ever felt normal. So it's adaptive. The benefit for them, and it may have been a pathway of behaviors leading to the heroin use that were adaptive that finally led to the heroin, so they are adaptive. As trauma-informed providers, you would say, not what's wrong with you, don't you know, don't just quit. You won't do that anymore. You'll say, what happened to you? And you will get their life story as a part of encounters with them and understand their life story, and then you begin to develop a relationship with them that's based upon their life story, and yours too. And this is the idea of trauma-informed care. It's not a protocol. Well, if someone has high ACEs, then I'm going to open a book and I do X, Y, and Z. It's a way of relating differently to people, and it's probably very healing and helpful. That's trauma-informed care. And it can be done for all of these ACE-related issues, mental health, substance abuse, all these behaviors. Criminal behavior is adaptive. Here we have attempted suicide going up very strong. And this is the strongest relationship that we saw between high ACE scores and low ACE scores in everything we looked at. The highest risk of anything is the risk of suicide given ACEs. Here we have liver disease, ACE score going up, liver disease. And in a life course pathway, you now might be able to deduce why people with high ACE scores get liver disease. How do you get liver disease? Alcohol, shooting drugs, getting infected with a hepatitis virus from shooting drugs, and it's also a sexually transmitted disease. So the adaptations to adversity that lead to that are behavioral adaptations lead to risk for disease. Fully understandable. Here we have the kiss, to move to a piece of art. And I'm going to stop here. That's a beautiful piece of art. So sometimes after meetings, people go, man, you really depress me. I feel hopeless. And I need to be careful with this information, tell you, this information to me is really hopeful and exciting because it's so non-random. If you change the amount of adversity that children experience, if you reduce the amount of neglect, that is, make sure that they get the good stuff that they need, the ACE scores will be lower in the next generation, and the overall height of all these bars will go down. This is highly preventable stuff if we can figure out policies and practice to educate everybody to do it. The ability to prevent is unprecedented in humankind. It far exceeds anything else we've ever been able to prevent. The potential for prevention is enormous.